And if the agencies that we're supporting are doing outstanding work, we see no reason to leave them and to go somewhere else. Being that there's so little data on nonprofits and historically so little data on the demographics and the communities that we're focusing on, Healthy Cities is providing us of a neighborhood and see what the competition is there. So what we're looking at are the demographics in the neighborhood, where are the highest risk families located, and where is the gap in services the greatest. It's like a layup, okay? Not like the layups the Lakers shot last night, but like the Celtics did. Anybody watch that game last night? Yeah, just it was very depressing. Anyway, so we're looking for high return locations, families that are the most vulnerable, and areas where services are the least. One of the ventures that we began about 5 years ago came about because of help from Yoli. It took me about 10 years to recognize, maybe 8, how important public policy was in what we were doing. And I talked to Yoli about public policy. She was one of my mentors and one of my teachers. Others were staff here at the endowment when I served on the board. But I think Yoli mentioned one day that I should meet people at the county departments of mental health and public health, children and family services, and child and maternal health. And I think gave me Cindy Harding's name and Wendy Schiffer, and suggested that I meet them to learn more about public policy. And I set up lunches with maybe 10 different people at the county and had a sense before the lunch that these were going to be people like you find at the post office when you walk in and there's 20 people in line and one window open and you hear a lot of rustling of papers in the background and even some laughing. But everybody I met at the county was truly outstanding, very, very committed, very passionate about what they were doing, very, very bright. And as I had lunch with them, I was amazed that this was the first time many of them had had lunch with a private funder. And I couldn't understand it because when I looked at the agencies that we fund, like the Mar Vista Family Center or Westside Children's Center or LA Child Guidance Clinic, if you look at the list of people who are funding all of those agencies, most of the funding are coming from the county departments. And in the for-profit world, if a group of investors are investing in a company, they're probably going to have members, the investors will have participation on the board, and they're all talking to each other to try to do what they can, especially in a new venture, to make that business successful. So I'm thinking, why aren't funders talking together, public and private funders talking together, to bring leverage to the work they're doing and help the agencies that they support be more successful? So fast forward, there's now an organization started about 3 years ago called the LA Public-Private Partnership for Investing in Infants and Toddlers. It's made up of private funders, large foundations like the California Endowment and the Annenberg Foundation and Hilton and Weingart, to smaller family foundations like the Atlas Family Foundation. We meet every 2-3 months. Half of the meeting is education, where we bring in people to talk to us about the research and science behind the early years. So all of the participants are becoming more knowledgeable about research and science that supports the investments that we're making. And now we've hired an executive director for this organization, and we're going to be doing a lot of collaborative funding. The tool of Healthy Cities is going to be able to give all of us, and these are most of the major and a lot of smaller foundations in Los Angeles who are interested in the early years, tools that are going to help make us much more effective in what we do. One last thing. Our website is atlasfamilyfoundation.org. My email address is richardatlas@mac.com.